signs coming out of South Africa that the worst is yet to come. Let's cross to our correspondents across the continent for their thoughts, starting with Ansoy, who's live in Nairobi for us.
Thank you, Salim. And just to pick up from where you have left, South Africa, really worrying signs there with the mutation of COVID-19 confirmed in the country. The new variant likely to be more transmissible than the previous one. And that means, it gets to infect people, it spreads faster. And that's really worrying. Scientists are also looking into whether the current vaccines and the therapeutics can work against the new mutation. That is still work in progress. We'll be hearing from President Cyril Ramaphosa later this evening.
I am collecting this data report about this
but right
doubt.
Now, we are seeing an increasing
how
number of
China
cases. Talking about the new
reporting
variant,
first one can control the disease in such a rapid manner.
From the region, as we have seen in Europe, with
there
the
is
variant
no
in the United
clear-cut
Kingdom,
death report
and therefore it's likely we're not
China.
getting the full picture.
China's total death report I has to collect.
African countries
and
were
if they
done very well at the beginning of the outbreak, partly driven by the experience they had had with other outbreaks, but also there was some element of fear and all the projections that were coming that were really grim. This time round, we are not seeing that same level of alertness from the governments. We're seeing some sort of laxity, but it's important to mention that the strategies that worked last year, which was mainly to contain the virus from spreading to rural areas, from spreading widely across countries, and many countries were able to do that. Namibia, for example, for months were able to contain the outbreak to the very few people who had come in and had been confirmed with the virus. But now it has spread into communities, and therefore the strategies this time around are going to be, they will have to be different in terms of dealing with the outbreak. And there's a balance. Lockdowns worked last year, but this time round, people need to work so that they can eat. And we saw the poorest were really affected when there were lockdowns because they need to work every day to be able to eat. And then there were also worrying reports of corruption that happened in various countries. The latest to take action has been Zambia, where the health minister has been replaced. He's being investigated over loss of funds. Other countries are also going on with investigations, including Kenya and South Africa. And then as other countries, wealthier countries, roll out vaccines, many of them are using emergency protocols or compassionate protocols, as they are called, because some of the vaccines have not yet been approved by the WHO. We're still waiting here on the continent. We're still waiting for those vaccines to get here. There is the COVAX facility, which is being spearheaded by the World Health Organization and the Vaccine Alliance, that has secured doses, but they have not yet arrived here. They're still working on the cold chain and trying to set up the infrastructure ready to roll it out. And Africa has huge experience rolling out vaccines, but then the vaccines are just not yet here. But then we have unapproved vaccines, for example, the Chinese vaccine, which the Seychelles has now rolled out in the country. So it's really a mixed bag, and things are really changing, as you said. Let's now take a look at what's happening further north in Egypt with Saleh Nabil.
The Egyptian healthcare system has been overwhelmed during the first and the second wave of the virus. Many people are struggling to find a hospital bed or an oxygen tank for a family member. Public hospitals can hardly admit any more patients, and private ones are too expensive. Although the government keeps saying it has provided all the medical capacities needed in such a crisis, many people are unhappy. They accuse the authorities of not directing enough funds for a fragile healthcare system and of leaving hospitals unprepared. A few days ago, for example, 6 patients lost their lives in 2 different public hospitals. Their families said they died because of lack of oxygen supplies, but the Ministry of Health denied that, saying their death was due to chronic health conditions. So far, Egypt has recorded around 150,000 cases, but that number does not reflect reality by any means. The Minister of Health even said that the recorded numbers might only be 10% of the actual figures. In fact, the government is being heavily criticized for not carrying out enough tests. So we cannot actually get what the real picture is, but it is widely believed to be quite grim. Besides, Egyptians are not that committed to precautionary measures. Many people wander around without face masks, and social distancing almost doesn't exist here in such a bustling city as Cairo. So life here is more or less business as usual.
The first COVID-19 case in Nigeria was announced on 27 February 2020, when an Italian citizen in Lagos tested positive to the virus. A few weeks after, a second case was reported in Ogun State, a Nigerian who had contact with the index case. And on March 23, Nigeria reported its first death from coronavirus. This was at a time the number of cases of people infected rose to 36, with Lagos as the epicenter of the pandemic. The government immediately imposed a restriction. First of all, it closed down its airspace to international flights and then imposed a lockdown. And for 3 months, the country was under lockdown. From July to December last year, Nigeria slowly witnessed an increase in the number of positive cases. In places like Lagos and Abuja, the government restricted public gathering and arrested people who flouted COVID-19 safety guidelines, especially in October last year, when a group of Nigerian youths embarked on massive protests to end police brutality. As the number of new cases increases, the death toll continues to rise. The Nigeria Center for Disease Control said 1,358 people have died of COVID-19 complications in the country. Nigeria has now hit the 100,000 mark of people who tested positive to coronavirus. With the largest population in Africa, the country is facing a situation that many fear could spiral out of control unless drastic measures are taken to curb the spread.
Chris Awoko there reporting. Now, Facebook has shut down the accounts of many Ugandan government officials, accusing them of trying to manipulate public debate ahead of the presidential election on Thursday. President Yoweri Museveni is facing a challenge from the former pop star Bobby Wine. An aide to the president accused Facebook and Twitter of being opponents of his political party. I'm now joined by Kasim Kaira, who was based in Kampala for the last 5 years. He joins us now from the newsroom.